the use of AI in the healthcare sector. I'll now move to briefly introducing our esteemed panel. So we have Dr. Vinod Paul, a pediatrician and former head of the Department of Pediatrics at AIIMS New Delhi, and is a renowned medical scientist and a public health expert. As a core member of Niti Aayog, he leads the health, nutrition, and HRD verticals. He has played a pivotal role in formulating the Ayushman Bharat PMJY mission, the Ayushman Bharat Health and Wellness Center scheme, and Poshan Abhiyan. Professor Paul also served as the chairman of the Board of Governors in suppression of the Medical Council of India for 2 years, from 2018 to 2020. Dr. Paul is fellow of the 3 science academies of the country and a recipient of the Dr. B.R. Ambedkar Centenary Award. He was conferred with the prestigious Ethan Domagachi Family Health Foundation Prize by the WHO at the 2018 World Health Assembly. I would now like to introduce Dr. Ricardo Baptista Leite. He's a Portuguese-Canadian medical doctor and has a broad background in global health, health systems, health science-based policy making. He served 4 terms as a member of parliament in Portugal, focusing on health and foreign affairs, and has held roles as a city councillor in Sintra and deputy mayor of Cascais. Dr. Baptista Leite founded the Unite Parliamentarians Network for Global Health, involving policymakers from over 95 countries. With over 15 years in academia, he chairs the Center for Global Health at Nova University and held positions at Cattolica University and a multinational health software company. I'll now proceed to Dr. Geeta Manjunath. Dr. Manjunath is the founder and CEO of Niramai Health Analytics and has led the company to develop a breakthrough AI solution for detecting early stage breast cancer in a non-invasive radiation-free manner. Holding a PhD from IISc Bangalore and management education from Kellogg Chicago, she brings over 25 years of IT innovation experience. Dr. Manjunath has led AI projects at Xerox Research and Hewlett-Packard India and was Xerox India's lab director for data analytics research. Her work has earned her numerous accolades, including the CSI Gold Medal, BIRAC Winner Award 2018, inclusion in Forbes Top 20 Self-Made Women 2020, and the Women Entrepreneur of the Year 2020 by Biospectrum India. An inventor with 20 patents, Dr. Manjunath has made significant contributions to the health technology and entrepreneurship sector. I'll now introduce Mr. Sameer Kanwar, who is a Director for Digital Health India and South Asia, PATH. With over 3 decades in the digital information and communication technology sector, Mr. Sameer Kanwar is an expert in strategic planning and the adoption of cross-cutting technologies across diverse programs. He currently serves as a Director for Digital Health at PATH, focusing on the South Asia region, where he strategizes and implements integrated digital health systems for health system strengthening in these countries. His past roles include Director Digital Health and ICT at the University of Manitoba in India, Head of National Nutrition Resource Center at Tata Trusts, and supporting the ministry in the implementation of Government India's flagship National Nutrition Mission. Sameer has also has steered his own startup in digital space and has had an illustrious career of more than 20 years working with the government in various capacities. I'll now move to introducing Mr. Girish Raghavan. Girish is the Vice President Engineering at GE Healthcare, and he has an experience of over 24 years specializing in product development, technology, engineering, and leading global development centers. During the course of 2 decades at GE, he has held numerous engineering and technology leadership positions in the fields of software, hardware, systems, services, and digital engineering. Currently, he's leading the Healthcare Technology Center India at GE Healthcare South Asia and the Global Engineering for Edison Platform, a strategic project for GE Healthcare. I'll now proceed to introduce Mr. Kiran Anandam Pillai. Kiran is an advisor with the National Health Authority, NHA. He's also a volunteer supporting NHA to create digital public goods under India's 2 large digital health initiatives, the Ayushman Bharat Digital Health Mission and the Ayushman Bharat PMJAY. Kiran is a telecom engineer by training and was a founding member of On Mobile, where he helped build it to become a public company. He has also volunteered with UIDAI for the Aadhaar program and with the iSpot Foundation on the health stack. He dedicates his time to driving impact in healthcare. He is the founder and CEO of iDrishti, which delivers high-quality eye care from the district capital to the village level across Karnataka. iDrishti currently manages 12 high hospitals across Karnataka. So we welcome you. I would now also like to introduce Dr. Karthik Adapa. Dr. Karthik Adapa is a 2008 batch IS officer from the Punjab cadre who has recently been appointed as a regional advisor digital health, WHO, Southeast Asia Regional Office. Previous to this, he served as the Special Secretary to the Government of Punjab, Department of Health and Family Welfare. Dr. Adapa is a medical doctor with a master's degree in public policy and public health and a PhD in health informatics from the University of North Carolina, Chapel Hill. Dr. Adapa is a practitioner, researcher, and educator. His research today focuses on designing, developing, and implementing various health information technology interventions. Dr. Adapa uses methods from the human factors engineering, implementation science, and machine learning based on his training in internal medicine, public health, public policy, and health informatics. We welcome you, sir. I would now hand over the floor to Dr. Adapa to guide the conversation. And once again, thank you, everyone.
Good morning, everyone. Is my voice audible? Okay. Awesome. Thank you. It's a very exciting panel that we have. Good morning, ladies and gentlemen. Can you all hear me now? Okay. We have a very exciting panel here. We have some regulators. We have some good startups. We also have the non-profits. We also have the for-profits. We also have a colleague from Health AI. So it's a very interesting forum. So what I will do is I will step back and take an initial shot at asking a very general introductory comments, and then we'll deep dive into each of the issues. So if it's okay with each of the panelists, it would be interesting if you could talk about your initiatives on the safety of AI in healthcare and general comments on how do you see movement towards using AI for both safety and quality of care in general in healthcare, and how do you think recent innovations like the Gen AI, how do you think they would be influencing the delivery of care in healthcare, and how do we also ensure patient safety in the process? So if there are some general introductory remarks and any other initiative that you think you've been doing, you want the audience to know, that would be very interesting. Maybe we can go from left to right.
Thank you, Dr. Karthik, sir. Good morning, everyone. It's a real pleasure to be among people of common vision and interest of healthcare and AI coming together and making it real. And it's a great pleasure and privilege to be among esteemed panelists, co-panelists as well. I'm Geeta, as you're aware. So just a little bit about what we do and then relate to the different questions that Dr. Karthik sir mentioned. We at Niramai have developed a new method of detecting breast cancer using artificial intelligence over thermal scans. As we know, breast cancer is a top cancer, killing so many women. You know, in India alone, it kills close to 1 lakh women every year. It's unnecessarily, literally unnecessarily, because these women would have lived longer if the cancer was detected much earlier than finding it by hand. So for this problem, we have developed affordable, accessible, portable, safe, basically radiation-free method of detecting breast cancer. The good part is, for this audience, it is completely powered by AI, and AI is the differentiating factor which makes this happen. Because thermal scans have earlier been used for detecting or at least guessing if there is something wrong, but adding AI makes it accurate enough compared to the existing methods, or in some cases much better sensitivity than existing tests, to make it really usable. Now, addressing, I think there were many questions in your initial query. I'll try to sort of say a few things about this. First one is the safety, right? So there's safety are in, you can think about safety in two ways. One is physical safety, and then because you're using AI, which is obviously using computers to make a decision and possibly human intervention, the safety with respect to the outcome that the algorithm itself gives is also very, very critical. So from the first part, safety and efficacy aspect of it, particularly our own test is completely radiation-free, no touch, no see, and so there is no physical harm that is done. Having said that, we all know that regulatory bodies, first and foremost thing that they look for is safety and efficacy of the device before handing it over. Or if you're doing a clinical study, the first and foremost thing that an ethics committee looks at is this new device being tested doing any harm to the person now or in future in the, basically any, adverse events that are reported in the next few years, all that has to come in. So any medical device that's going into the market should make sure it has gone through the ethics committee approval and clinical studies which are proving the intended use of the device, right, to sufficient level of accuracy that is needed. Especially when we have AI-based devices, there's always this, what is sufficient enough? Obviously, the best thing is 100% sensitivity and 100% specificity, which obviously no tool can give, no human being also can give, no expert doctor can also, I believe, claim, right? So there's a lot of thumb rule that people use, and one of them I heard, and it may be useful for some of you working, is that if sensitivity plus specificity is 150, like sensitivity is ability to detect cancer or any other disease, and specificity is ability to detect no cancer, right? So if that combination or literal sum is more than 150, it is ready to at least start doing a study and prospective study, and if the results are good in field, then you can use it. So this is one level of safety I would put from an accuracy standpoint, which is the outcome of the machine learning algorithm itself. And the first part, which I was mentioning, is about going through an ethics committee approval, which means that there are 15 people looking at the same device from different perspective and bringing in the safety guideline and moving on. So I'll pass the mic right now, and happy to answer any question further.
Thank you for the opportunity to be here. Yeah. So just to look at from a G healthcare standpoint, what we are doing today, I would say we're trying to put patient at the center of the ecosystem. We're trying to get patients, we're trying to become more patient-centric. We're focusing a lot on preventive health and predictive health and so on and so forth. But where we are doing a lot of work with AI coming into picture is about how do we provide a longitudinal patient cohort or patient jacket, wherein if you're a clinician looking at patient data, you're going to get a cohesive set of information across the entire continuum of the patient through which you can make very informed decisions. So that is, a patient centricity becomes a very core element of what we're doing today, and AI obviously plays a very important role there. If you take an example today, if you go to a large hospital, you will find there are very different data stores there. You have a data store for genomics, you have a pathology system, you have a imaging lab, and so on and so forth. But today there's no means through which you can correlate all the information together and put them as a very useful insight for the clinicians, right? So that's exactly what we're trying to do today. We're trying to build layers of software using AI and NLP, which will be able to extract information from very disparate sources and trying to provide information in a very useful manner for clinicians. So patient centricity becomes one of the core elements in which we are working towards. And all these are more targeted towards precision medicine, right? The second thing what we're trying to do is about how do we make systems smarter and intelligent, right? See, the fundamental philosophy what we had traditionally has been that the systems are dumb and the operator has to be super intelligent to operate a system. I don't know if anybody here has operated a cath lab or a CT scanner or so on. So it's pretty complex, right? So what we have been doing in the last few years has been to make the system smarter, where the systems would in turn tell the operator what to do. So we are trying to democratize patient care. If you go to a tier 2, tier 3 city, you'll find a lot of cases that you don't have very highly qualified or experts in the space. And we have seen a lot of cases where the systems are so smart, the system would tell the operator what has to be done. The systems are so smart, it can connect to a hospital information system, it can connect to a radiology system and so on, so EMRs and EHRs and so on and so forth, and provide feedbacks to the operator. And there are a lot of cases we have seen where you have systems, you're doing an MR scan, the patient has moved quite a bit. And before the patient leaves the table, the system would tell the operator, looks like the patient has moved quite a bit, you need to do a rescan. So the focus there has been always towards efficiency, productivity, patient experience, and how do we streamline the workflow. So these are the two big things I would say what we are focusing as a company today. And coming to Dr. Karthik's question about the focus on AI and what we're doing. So firstly, if you look at today, in Bangalore, right, we have the Jack Welch Technology Center where we have the largest set of scientists and technologists for GE healthcare globally. And we are also the powerhouse of AI. We have the largest pool of data scientists and AI for GE Healthcare there. And you would have seen recently, in our RSNA, recently, if you look at the FDA approved applications, what we are definitely number one in terms of the number of AI applications which have been approved by FDA for 2 consecutive years. So that itself shows, right? So coming to, I think Geeta answered a lot of questions around that. But one thing I want to also highlight is the topic about specificity and sensitivity, right? You'll never get to the 100% bar what you have in your mind. So one of the things what we do, and just to add on top of what Geeta mentioned, she was spot on, is that we also have the focus going towards responsible AI. So we have systems in place for ML ops, right, where you can look at concept drifts, you can look at data drift, right, and you have to constantly have a loopback mechanism through which your models will be able to keep on fine-tuning it as you get more and more data. Because the models what you build will never be 100%. It is an evolving, it's a journey. I've seen a lot of companies which talks about I build a model, it is perfect and it's done, which is not true, because as you get with more and more data, the models will definitely look at concepts and data drifts, and it is a very important imperative to get the models back on track so that the outcomes are still valid. Okay.
Thanks, Girish. Good morning, everyone. So, I'm going to talk about 2 perspectives from my experience. One from my work in actually trying to use AI-based tools in eye care. So many of you might be aware that we have a raging number of people with diabetes and hypertension, and one of the things that's advised is that you should actually have a retinal checkup because diabetes can damage your vision. While it's easy to say, in a country like India, one of the core challenges is that you still today need an ophthalmologist more or less to actually dilate your eye and look at the back of the eye. It's not so easy for someone to look at the back of your eye and say, okay, how are you doing on your diabetes? So this has been an area, it's been very fascinating for me to watch how over the last 5 years, a whole variety of startups and tools have actually tried to tackle this problem. So there are 2 sides to this problem. So the first, and I think that's where I think I've been as fascinated as the AI technology side, is trying to ease the imaging of the back of the eye. So there are many startups out of India that have actually tried to make sure that an semi-trained or untrained operator, and very recently I saw a device which actually requires no training, where someone can actually perfectly image the back of eye with a quality of an image that's good enough for a diagnosis. So without something like that, actually we cannot take screening devices really into the field, into the mass market to be used by doctors. So I think one significant shift I saw in the last 4 to 5 years is the improvement of these devices. The second thing that of course has happened is now from these images, you're actually, AI tools are able to give you a very, very good prediction on many things. Diabetic retinopathy, glaucoma, ARMD, and so on. And I don't know if any of you have been following, but Google Health has actually shown that the retina is one of the first places where you can start seeing other changes in the eye. So they're starting to do cardiovascular risk prediction based on image and so on. So, but for me as a user, so I think I'm quite fascinated, and I do think that in the future, most probably our general physician might actually take an image of your eye to tell a lot of things as we go in and as these tools get better. One challenge for us as users has actually been in terms of how do we understand validation. There have been many, many players who have said that, look, we have taken all these retinal images, we have run algorithms, and we are able to provide this prediction. But as a end user, what do I trust, and what do how do I say, okay, I really think that they have this? And today, I think we have to do as individual users a lot of thinking through the validation. And so, how the validation environment for India evolves, I think, is going to be quite important as we start looking at AI and AI tools. The second thing, of course, is that in the West, where there's a lot of medical information, people have already shown that taking this data and having it quickly summarized for clinicians is starting to become very useful. I think many of us have been using things like ChatGPT to take a big document and say, hey, summarize this quickly for me. I have a couple of friends who work in the AI space in the US who have been actually doing that on medical data. But if you look at it from the Indian context, one of the key problems that we have is that the fact that we really still are not able to pull our own health data together. So the second initiative that I've been part of, which is the Ayushman Bharat Digital Mission, is really trying to go there. But of course, we are not there yet. In many ways, I think it's a start. But the idea that you could bring your health information together, and in the future, AI would start looking at it to help you take care of your health better, is definitely a direction that I see, but of course, it's an area that in space that needs to evolve. Thanks.
Good morning, everyone. So I think I'll start with a quote which was said in the late 1980s, probably at the advent of AI, by a gentleman known as Alan Pursley. He was a computer scientist, and he said that working with AI for 1 year is enough to know God. And then we've come a long way from there. Right, it has both sides. We talked about the regulations and the ethics pieces of it, right? And right in the morning, me and Ricardo, we were discussing that the technology is changing extremely fast. And how does the regulatory frameworks and the ethics which we are trying to set around AI is ever going to be functional and probably be used at some point in time, because things change very, very quickly. So like Ricardo was mentioning to me in the morning that, LLM were supposed to be the low risk, and suddenly ChatGPT came and we all popped up and said, oh no, it's high risk. So how do you actually grapple with this technology which is coming our way? Having said that, at Path, we largely focus on public health and have been working in this space for quite a few years now. In India, more than 25 years, across the world, about 47 years. And technology becomes a very integral part, but then the way we look at technology is, not in terms of because technology is available, therefore we need to apply it, right? We look at it from how does it help me bridge a gap? If I'm looking at primary healthcare, how does X technology help me bridge a gap? Is there a gap which I'm filling up, right, in public health or not? Otherwise, deploying technology piecemeal and siloed is what we've been doing, whether it is AI or any other technology, right? Does it actually lead to the desired results and the outcomes? No, it doesn't. So therefore, we look at the integration of technology with the existing system strengthening and service delivery of systems. In fact, one of the products which we are, it's almost like getting scaled up in one of the districts in Maharashtra is Niramai's cervical cancer, piece which Geeta was talking about. Largely from the public health perspective is one issue. The second, I think, also is from the perspective of our health service delivery is dependent upon the private sector across LMICs, right? And it's almost like 60% dependency on the private sector. And how are we engaging the private sector to be a part of this journey when we are looking at technologies, right? So I think COVID helped us in that, because pre-COVID we were just running, on different tangents. So public health never used to talk to the private sector, and neither did the private sector had any interest in public health, right? Probably I think it took a COVID for us to shake up and probably try and get these two sectors together. And I think as far as India is concerned, from the technology perspective, we are extremely well placed. We are extremely well placed in terms of looking at integrating the public health and the private health space to look at health service delivery and not call it public health service delivery and the private sector health service delivery. And I think ABDM has been a great initiative in terms of bridging this gap which was there and providing the required backbone. I'll take a pause here and probably dwell more on what we do as we move in the panel. Thank you.
Okay, I think this was a very good introduction. I wanted to kind of step back a bit, and I've thrown a lot of questions there to just get us warmed up. I'll kind of get into a little more of fundamentals into what's the theme of this conference, which is more of responsible AI. There's a lot of conversations on what should those frameworks be to set in what is a responsible AI. Now, I know some of the work that Dr. Geeta has done, so I will first start with her. Dr. Geeta, on the way Niramai has built its breast thermography augmented by AI, can you actually walk through what do you think as you built? I mean, people did not talk about responsible AI 5 years back, even in the research arena, even in the most developed countries. So when we started working essentially on AI, we were essentially thinking about how do we develop AI, not just as develop, build, design, implement AI, but today the thinking process is just like how you would have a drug, which goes through multi-phased clinical trials, both for safety and efficacy. There are examples, both in LMICs as well as in the developed world today, on how do you truly take from the proof of concept stage and then truly implement it in the clinical environment. Now we have an example from Niramai, which has really walked in, which has a very interesting journey, right from the stage of a proof of concept and it has essentially been implemented as a population level screening tool in Punjab. So I wanted to kind of wanted to ask you on what has the journey been when you were probably blindfolded on what really should the framework be. So if you could enlighten us on what were, and purely because it's a research conference, if you could talk through the methodology that Nirma has used, and if you could deep dive into what should responsible AI framework be for the times to come.
Thank you for that question. And the last bit was amazing because yes, we have implemented it in Punjab in 15 districts, and with just one device going around for a few months, already 22 cancer patients have been treated, right? It's some more are coming in, like they're doing the follow-up diagnostic, and Dr. Karthik sir has been a huge supporter after he learned about it. Midway, I think that's when we presented an interim report, and he said this has to happen, and then he made sure that all the people are aligned. Thank you for that. So just from a journey standpoint, as you mentioned very rightly, 6 years back when we started, all I knew was just jumped off from my job and said, okay, we have to make this work. And I didn't know what a startup meant, how to raise funds and all of that. And definitely I knew how to build AI models and lead teams. But then how to take an AI model onto the ground, put it in a field, put it in a hospital, right? So that definitely was an issue. So first thing that I think that comes across is like literally common sense. If I were a user, what would I expect from the device that I'm using it? So when you actually put yourself in the shoes of your end user, not the customer and end user are different, by the way, many times different for especially healthcare and AI and all of that. So both aspects are important, but to start with, when you're talking about responsible AI, I think we always have to keep the end user in mind. If I were, getting detected with breast cancer, or the tool says that, and then I would go about doing the next test, and it was negative, how would that be? So the first thing was the false positive part of it, because there can be a lot of emotional trauma. So what we did was the messaging of it. Though our intention is to detect breast cancer, but we message it very plain, saying that it detects breast abnormality. And to be on the safer side, you need to do the follow-up diagnostic work, because obviously everyone knows biopsy or histopath generally, is the final golden truth, and no imaging can replace that or be equal to that. That's plain, right? So messaging accurately, if you see in our reports, nowhere we mention cancer or malignancy. We only say you require a follow-up diagnostic workup. So that is first thing from a false positive standpoint. False negative is something that we said we should never, if possible, never ever have a false negative. Touchwood, so far we have maintained that, and whatever so far mammography or ultrasound has detected, or even MRI to a small study, we have been able to identify that as false, as true positive. And then of course false positives are also much lower. So ensuring that your AI model, it depends. This particular, whether you want to prioritize sensitivity or specificity is very much dependent on which intended use it is, which claim it is, so it's very, very, specific to your device. But first of all, sitting with the end users or being in the end user's shoe, and then discussing with the doctors who are going to be your customers, and figuring out what is more important for the use case that is very, very important. In our case, if you're going to use this as a screening or a pre-screening, if that makes people happy, right, then we have to make sure that we do not hopefully miss any cancer. So that was one aspect, and we have fine-tuned our AI algorithms to, the loss functions and all of that, so that, we try to prioritize sensitivity over specificity. The second thing I think is really validation. I think there is no second thoughts about being responsible. There are different ways, training. How do you train the model, right? Are you going to have a mix of all different types of abnormalities that can happen, benign as well as malignant? It's not sufficient to just say normal patients, malignant patients, I'll train a model and it'll detect. There'll be so many benign cases, different types of benign. So initially, we didn't know what we were doing, obviously, as in like where we will end up rather. But there was no single breast thermal image available on the public with a biopsy result next to it. So every bit of the 600,000 plus images that we use and have today is collected by us. That's why it took so long, right? So initially, so we said every person gets our test and she goes through all the remaining imaging tests that conventionally is done in a hospital, which is mammography and ultrasound. And if she's positive, she goes through a pathology, that is histopathology as well. So the biopsy result is used as a class label to train our model. So how authentic is your training data with respect to the ground truth? Because today there's no doctor who can look at a thermal image and confidently say whether it's cancer or not, because it's a very, very complex problem, and that's why thermography as such, which is a visual analysis, is a lot controversial as well. So we wanted to make sure we will not ask a doctor to view a thermal image, but we will actually go with what is considered as golden truth to do the labeling. And then how do you choose the training sample itself, right? Like I mentioned, many benign cases. So we had, instead of random sampling, K, K times running the testing training and all of that, what we did was we actually picked the samples for training, handpicked the samples from different types of diseases, or rather benign diseases, and then train the model. It's okay, it's not, of course, there's always a research paper and we have one saying, how does the model itself work? But here it's not about how my model is great. It's really about how the end product is great, right? So for that, we need to do what it takes, But of course, for the testing, it has to be completely blinded. You start with a retrospective test, that is, you already have the data, you try to get the answer. Then, unless you test in the field, because there's a person coming in, and if you know the answer, we all have done AI programs, right? We can always fine-tune our algorithms to work well if you have a pre-labeled, fully labeled data, visible and all of that. It's about, the doctor doesn't know when they are treating. The ML model also should not know when they are testing what the label itself is, and predict and then do a prospective. I think prospective studies in the field is definitely important. And just in the interest of time, the other last bit is prospective study in the field in a hospital is only possible because you have the other tests and all available. What happens if you give the test in the hands of the real health workers, That's different. So we started seeing that people were calling left breast as right breast because there's a mirror image that comes in, and they were missing some views, and they were like in a hurry because there were 10 patients waiting. They were not waiting for person to stabilize before imaging. So we came up with novel algorithms to check the quality of the data that is coming in, right? Garbage in, garbage out. So we have to make sure that the data that's coming in. So all these, I think, was more in terms of, we have to make sure we are responsible enough when the output is given, we are okay to trust the solution ourselves, right? So that's, I think, was a broad thing. And a framework perspective, I think, if we can actually lay out I think FDA has done a great job already trying to put together the framework of what are the different types of clinical testing that needs to be done on a model, this aspect. And another thing that my co-panelists talked about is training on the go. So there is this concept of locked models versus, online learning. Even today, no regulatory body has allowed online learning healthcare model to go on the field. There's a lot of debate happening. How do we, just because you learn again, can we go back to the regulator all the time, that is FDA all the time, to sort of, every time you learn. So that is still there, but there are certain frameworks to be, has been proposed to try and see, okay, can we have more like a regression testing? You have a data set. As long as the data set, the accuracy is met when you do a relearning on this particular data set, then we can go forward. But that is still, as far as I'm aware, it's still not fully implemented in US FDA. But hopefully, we will be responsible again, even when you're doing online learning, and that's what we do. Whenever there is a new model that is built, it will still go through the rigorous product testing that a software testing team would do. With a regression test, as long as the sensitivity and specificity has not gone down from your previous model, only then we'll release, otherwise we do not. So to some extent it will address the drift aspect that earlier it was mentioned. Anyway, so with that I'll try to sort of, sir, would you like to?
I'm audible? Hello? It's better now? I would like to just add one additional point on what Dr. Geeta mentioned. This is, if any of you are interested, you can look at Stanford School of Medicine, right? They have done some very interesting work on responsible AI. They have got this concept called RISE Health, which stands for Responsible AI for Safety and Equitable Health. Okay, so they're trying to come with some frameworks on how, because this is still a very growing area. It's not well explored. We're also learning as we go. I think Geeta covered that pretty well, right? We're all learning as we go through the journey. So the work done by Stanford School of Medicine is really phenomenal. They put together a framework where how do we bring in safety and make sure healthcare is equitable through a well-defined set of structural framework. And one of the very important elements what they have referred there is about having a diverse set of experts, multidisciplinary experts, who are part of a committee who would constantly keep evaluating what's happening and then making sure it is not deviating from the objective what we have. So that is one. And again, if you look at Stanford, again, they've done some phenomenal work on how do we make AI more human-centric. Because one of the biggest worry about responsible AI being irresponsible is, are we going to go away from the human-centric approach what we have? So they also built frameworks around that. I think if any of you are interested, you could dig deep into that. And a lot of companies around the world have having that as our gold standard. We're trying to look at that in a holistic manner. Any other panelists?
Just I think a couple of things. Unlike in Dr. Geeta's case, where I think there was absolutely no data and they had to build the whole data set, iCare had the advantage that essentially doctors had been looking at the retina for a long time, and so really what you needed was somebody to label and say from retinal images what was the case. But I think an interesting aspect that I felt, which I'm sure Nirmay would also have to look at, was when we actually had to take products like this to the field, especially to rural markets, where connectivity was an issue, the question became whether you could actually run these models offline and in smaller devices. So I think one of the very interesting trends have also been about being able to run AI models on devices, including on mobile phones. So much of the technology that we now use for screening for retinal images to get an initial screening output actually just runs on the mobile device. And I think that's another fascinating evolution of how people have been pushing the use of or delivery of these AI models. Thanks.
Okay, I've been briefed that the theme for this specific one is universal health coverage and AI. So I wanted to kind of throw it up a little more open and say, do folks on the panels have any examples of how AI is being used in universal health coverage? And especially, we'll have to get into this buzzword of Gen AI, and there's a lot of conversations on how Gen AI can essentially be used to transform a lot of applications in healthcare. I have some skepticism on Gen AI, so if there are initial enthusiasts on how Gen AI could typically be used for universal health coverage, if they have examples that they've used at their work, if you want to share, that would be very interesting.
I'm not too sure whether we have examples of Gen AI being used for USC, but I think I just wanted to drive, using that point, just wanted to drive something extremely important when we look at public health is, are we actually wanting to solve real health problems through technology or not? For example, let's say I'll just quote Dr. Vinod Paul. He keeps talking about, the first 1,000 days, how important they are when we are looking at achieving the SDG goals or looking at the next generation. Because if you miss out those first 1,000 days, you lost the battle actually. You can keep coming back and trying to, look at the malnourished children and all. But I mean, really, you don't have a solution for it. So how does technology help us, probably solve those problems, right? So can the HRPs be predicted and managed through, let's say, some AI tool? Can we predict stillbirth? Can we handle LBW children? Can we ensure the required service delivery is available at the right point of care or not? So all these problems can be worked out through technology, right? But then there has to be an integrated approach where we are looking at service delivery, we are looking at health system strengthening, and then we are looking at what role can technology play. For example, let's say look at resource management. Now, WHO predicts that probably 13 million lack of health workforce is going to be there in the world in about 2030. So are we moving towards, can technology help me bridge that gap? We've seen telemedicine and we've seen the, application of telemedicine as part of COVID, and e-Sanjeevani is a fantastic example in India, right? Can that be used? Can there be a decision support mechanism which can be built on top of telemedicine, which can support, let's say, a healthcare worker at the community level to be able to probably do the initial screening, do the initial prediction, right? And how do we use technology for screening? I'll give you an example. I think about a year and a half back, there was a report on TB. It was a very small sample size in India, but it said that 50% of the cases were asymptomatic. Right? Now, if 50% of the cases are asymptomatic and we are looking at population level screening, can we just run all X-rays which are taken in the country, let's say in the public health sector, through, let's say, an AI tool which tells us, oh, these are the suspected cases for TB, and then probably you can go in for the gold test. So I think the application of technology is important. Integrating technology into the health system strengthening is extremely important. And third is, where do you apply a particular technology when you look at public health care? Because can this be applied at the community level? Can this be applied at the primary health care level? Or is it at a, at a higher end that we need to look at probably at a district hospital or probably a specialized hospital? So I think that's where the communities need to come together to, be able to guide the technologists, right? To look at the application of technology rather than, technologists just developing products and, sending it out to the market. They don't even know the market. They don't even know the potential market, right? So where is the market? Who defines the market? And then who's able to guide them into getting products which are actually solving real-time problems? I think that's where the focus should be. Thank you.
Well, I wanted to address the question of universal health coverage, and picking up on where Samir left off. I think that we have to take into consideration that the world has put universal health coverage as a goal by 2030 under the Sustainable Development Goals. We're halfway through. These goals were approved in 2015, and we've only completed 15% of these goals. So out of the 50% we should have achieved by now, we've only achieved 15%, so we are failing miserably. So if governments were CEOs in a company, they would have been fired by now. And so we need to acknowledge very quickly at a global level that governments alone cannot do this. We need the private sector. And technology can be a leverage in the direction of achieving universal health coverage. But I think it's also very important for us to think in a session on global health what universal health coverage actually means. Because applying good technology on bad policy leads to bad results. It's not just bad data, it's also having a bad framework on which it is built. And today, what we are seeing is that the richer countries of the world have developed broken systems that we call health systems, but in reality are disease systems. They are disease-driven models that spend 98 to 99% of their resources reacting to disease in an absolute failure to prevent disease and promote health. And this is leading to a rise of costs and to a rise of the burden of disease that is unsustainable and will lead us to hit a wall sooner or later. And what we're seeing under the mantra of universal health coverage is exporting these disease-broken models towards low and middle income settings. Now one can say, and I fully agree with Samir, technology can help solve many of the underlying problems. The lack of healthcare workers is probably one of the most stringent. But to do this, you need to make sure you have the regulatory landscape ready for that, particularly in low and middle income countries. My presentation will be focusing on our work at Health AI and how do we aim to address that. But it also means that we have to have the capacity in these countries, in low and middle income countries, to actually use the technology, which means that it is unacceptable that the most expensive gigabyte of data in the world is in Africa. It's, when you look at the data, the further away people are from living from a hospital, the lower the probability they have access to the internet or to a smartphone. And so many times we are saying that technology is going to solve the problem for the most marginalized and the most vulnerable. But what is happening today is a widening of the digital divide. And we're seeing attempts of digital colonization happening. And we're seeing extraction of data happening in low and middle income countries with no oversight of the people and of the governments. We need to fix these underlying issues urgently so that those that could potentially benefit from these technologies actually have an opportunity to do so. Because if we do not do this, The richer will just get richer, and the poor will just get poorer, and the people who live in low-income settings will inevitably just get sicker and sicker. And this is something that I think we need to address. I've been to Sub-Saharan Africa a lot these last few months, and being in countries where I see more children die than elderly is a symptom that something is wrong. And so there are potentials there. We've seen the technology, and Gen AI can potentially play a role in a controlled regulatory environment. But all of that only makes sense if we fix the underlying problems that I think that we all have a tremendous responsibility, and that's why I'm so happy to be here in India. Because India, especially with the presidency of the G20, has taken the role of leadership for also those in the low and middle income countries of the world, seeing in India a voice that I believe can actually help with this transformation to make sure that we leverage the technology to serve the people. And just to end on this note, there's a very interesting book called Power and Progress that I recommend you read, which looks at the evolution of technologies over the last 1,000 years. And in every era, a new technology comes up, and the technologists that come presented say, this is going to solve the problems of the world. And when the historians look backwards, what they came to the conclusion was very rarely did those technologies actually lead to better health outcomes and better societal outcomes for everyone. Almost everywhere, it benefited the few at the detriment of the rest. The few times in which history has shown where we were able to use technologies to leverage society as a whole, including those in most marginalized situations, was in the cases where the technology was designed from the start to be fair and inclusive and transparent and accountable, what we now call responsible AI. And so I think we should learn from the lessons of the past. Now that we are what some people are calling at year zero of AI in health, to develop a landscape and a framework for the application of artificial intelligence for health that actually is inclusive and doesn't leave anyone behind.
Awesome. Thank you. Thank you. That was a great, an extremely passionate plea on digital divide, digital illiteracy, and how technology would expand the gaps. So I think in interest of time, I would want each of the panelists to kind of summarize in just a minute or so before we move on to the keynote speakers. So any last concluding remarks, any of the panel speakers who want to speak? We could probably start from there.
Nothing much. I think we need to look at technology from the perspective of an enabler, what Ricardo was saying, right? Rather than being the front runner or being the soldier on ground, right? It can only do as good as the way it is applied, and when it is applied within a structured framework, right? Until we've got a framework and we understand where technology is to be applied, probably we'll end up again failing and creating these inequities which he was talking about. Thank you.
So I'm an eternal optimist, and I'm a big believer that sometimes we can't see the pace of change. Our minds are linear when we look at the past. And I think really if we come back here in 5 years, I think the amount of how much data, each of us are generating so much significant data. I wear this watch, the amount of health data it's generating is significant. I think we have various technologies and things that are trying to bring our health data together, like the ABDM initiative. To me, it's not going to be very surprising that the way healthcare is going to be delivered, using my data for my benefit in the next 5 years is going to significantly change because of AI. I am looking forward to it. At the same time, I am also very interested in seeing whether the right set of regulations and frameworks that make sure that it's safe and that I'm getting the right recommendations also kind of come into play.
I think in my view, I believe that we are actually at the crux of a huge healthcare transformation, right? It's significant. If you go back and see in the 80s and 90s, right, what we saw for telecom, I think healthcare is going to be maybe in the next 3 to 5 years, right? I'm sure some of you know, if you look at your banking experience, when I was a boy, I used to take almost a day to go to a bank and come out, right? You start after breakfast and you come back after tea, right? To get going to a bank. The bank manager was and the postmaster were the most important people in our lives. So today, right, how things have transformed thanks to technology. So we are exactly the same juncture. I think 3, 4, 5 years from now, healthcare would be in a very different place. We have to make sure it is equitable, safe. Should make sure it is also reachable, accessible to the masses, right? I think that's what the key aspect is, and AI is definitely going to make a huge impact. I can tell you guys there's a lot of work happening on generative AI, lot of work. People don't talk about it, obviously, for obvious reasons. We are doing a lot of work. If you do 10 projects and even if one clicks, I think it's going to be massive. Okay, so stay tuned.
Okay. So my comment is more coming in from the Indian in me. I think all of us are very, very fortunate to have been born among people who require help, and we all have the mindset to try to solve this. So necessity is the mother of invention. We are at a place where India can play a very, very big role. We have, I think, one of the top 3 in AI and so on. And we are also in a place where, we have very, very few doctors. I'm not saying we are proud of being in that situation, but really we at least have an opportunity to invent for our own fellow being, and it's time for reverse innovation, right? What we invent can go to the rest of the world. And so let's all brace up and then try and solve a problem which is very close to our heart, where we feel this needs to be solved. And I think time to pick up the arms and fight. Thank you.
Okay, I'll quickly conclude. I think this has been a very interesting panel discussion. Let me also tell the audience that none of them knew the questions because the questions were prepared by the moderator on the go. So they've actually done extremely well. Thank you so much for the insights. They were not prepped. All the questions that they were given, they were not given those questions. What questions were given were not answered by them. So they've answered very fresh questions. So thank you all for your insights. We had very interesting perspectives, and I think I wanted to thank also the organizers for bringing together a very interesting panel, and thank you all so much for the audience for your patient hearing. I think we don't have time for Q&A. We'll move on to the keynote speakers, and after that hopefully you'll have time to ask a lot of questions to these very interesting panel speakers here. Thank you all.
I would like to thank the esteemed panelists for this insightful discussion. What we have gathered here is rightly that there is a lot of cause for optimism, but at the same time there is cause for concern. We should be excited about the technologies that are being developed for strengthening systems, for strengthening healthcare systems. But at the same time, we need to prioritize how and where we apply these systems and the people who are running these systems. And of course, the very basis of healthcare provisioning is based on empathy. We must not forget that, however AI is developed in the future. So on that note, I will invite Dr. Ricardo Baptista Leet to deliver the keynote address and just elaborate on the topic. Thank you so much.
Well, good morning. Good morning. All right. So we're talking a lot about artificial intelligence during 3 days. We can't forget the human connection. And that is something that I think is extremely important, because at the end of the day, the technologies that we develop, the amazing examples we just heard on this panel, are to serve the people. And we have also seen a lot of studies, especially in the media, focusing on the amazing outcomes that technology can produce. What we don't see much is how the symbiotic approach between humans and machines normally lead to even better outcomes. And I believe that the data is showing us, and the evidence is showing us, that the future of healthcare is going to be symbiotic. It is going to be a hybrid between machines and humans. And the sooner we embrace this new future, the faster we will be producing better health outcomes towards the well-being and quality of life of citizens. And to embrace that, and to address many of the issues of regulations that we were just talking about here, I am very proud to be heading Health AI, the Global Agency for Responsible AI in Health, which is precisely trying to do the foundational work so that in the future we have the regulatory landscape that is necessary so that everyone can benefit from these technologies across the globe, in partnership with very relevant multilateral organizations such as the World Health Organizations. So these people are all doing fantastic things in AI. We like to say we are the plumbers of AI.
And so in the sense that if we do our job right, nobody notices, but if we fail, the toilets will overflow. And we want to avoid that together. But before getting into the details of what we do, I just wanted to share some numbers so you have an idea of how big the transformation, the intelligence revolution is really becoming. And we're seeing that the market of 11 billion US dollars in 22 will quickly expand in just 10 years to over 400 billion, if not more, over the next, until 2032. And we're looking how the Asia Pacific is right now the fastest growing market, despite North America right now still being the largest, and as we can see here, and clearly India is playing a leadership role when we look here at the number of startups, for example. Big tech are all investing deeply, and this is what we know publicly from our colleague from GE. There's a lot of things being developed that we are unaware of. But if we just look at almost everyone is working, for example, on virtual scribes, which means that the idea of a patient going into a physician's office to see their family doctor. Today, 70% of the time a patient is in their office with their family doctor, 70% of the time they're looking at the back of a screen while the doctor is struggling away on a keyboard. In some cases with 2 fingers, right? We know the classical example. Well, the future we're seeing here is actually a future with no computer in the room, where actually virtually an Alexa or a Siri or somebody will be collecting that data and actually transcribing it into electronic records that just need to be approved, keeping the human in the loop. But all of the work of collecting the data, potential recommendations of action, and so forth, the clinical support tool will all be done virtually. And that's just a small piece of the many things that these big tech are investing in. And when we look at the top trends of AI and healthcare, we can see it across the board. From healthcare analytics to diagnostics, telehealth, robotics, you name it. It's across the board. Population health, of course, is there. Cybersecurity, I foresee with the rise of quantum computing, will be the biggest risk and liability, but also opportunity moving forward. And we talk, and also personalized healthcare, and looking into the near future, we will probably see a very important fusion between synthetic biology and artificial intelligence and machine learning play a critical role in what will be the future of healthcare. Very exciting stuff coming down the road. And if there was any doubt, it's not just about market share, it's actually about intellectual property. And when we look at the patents, the rise of patents since 2015 is amazing. And this is just until 2021. So prior to ChatGPT, just yesterday, so I was mentioning how there's the era pre-ChatGPT and post-ChatGPT, and we know that we are already on a rise. Now it's becoming exponential. But we are also moving towards a very fragmented landscape, where we're seeing that each country, almost isolated, is trying to have an approach to how to regulate, how to address these challenges. And fragmentation is a problem, because with fragmentation leads to complexity. There is only one beneficiary when we have a fragmented regulatory landscape, and the beneficiary is called the lawyer. The lawyer's offices are going to make a fortune because they have to adapt to the regulatory landscape for each company, for every startup, every small and medium enterprise that works in AI, that wants to go global. If they have to adapt their process to the regulatory environment of every single country, they will not survive. And so if we really want to foster innovation, we need to fix this fragmentation towards a harmonized approach. And so this is one of the big challenges, which is these evolving regulations. The fact that AI is so fast and this space is moving so quickly. How do we address this? Well, Health AI has defended that we should have light legislation but effective regulation, understanding that regulation can keep up to pace more easily to keep up to pace with emerging tech. Moving towards the global harmonization, as I've mentioned before. so that we can avoid what we're now seeing, which is this differential requirements in every country with varying approval processes and timelines, making it a legal nightmare for companies. Data concerns is very huge. I mentioned before how data extraction is happening with no oversight. This is a violation of individual but also nation data sovereignty. And this is something we need to address if we want people to trust the technology. And what we are hearing when you go to coffee shops where you see grandparents talking about artificial intelligence nowadays is the word fear of how, and you know, a lot of technologists and many of us are probably to blame because of the way we've been imposing these challenges. And post-market surveillance is critical also, so that we can learn from the past where we deployed a lot of technologies when it came to healthcare into the market without putting in place these mechanisms so we actually know if they're producing good outcomes. This is critical so that we know that we're investing in things that actually lead to better health outcomes instead of leading to more disease, which is what we are seeing in many Western health systems. So the need is clear. And when 6 months ago I took on this role, I stepped down from my seat in Parliament to take on the role as CEO at Health AI in Geneva. The thought process was to listen to governments, to listen to legislators, to listen to civil society, to technologists, and to understand what is the need, what do we need to address. And the word fear came up consistently because of the lack of understanding of technology, the lack of how to address AI, and also the potential impact that it could have across societies. And so the need is clear to address the lack of effective governance, which is increasing risks for citizens and systems alike, and also hindering the adoption of responsible AI solutions that could lead to better health outcomes. Because if people don't trust the technology, they won't adopt it. If they do not adopt it, that will slow down the pace of investment and research and development, which is now at a high, it's growing, but we need to make sure that we're creating then pathways to access to market, because all of this investment needs to reach the citizens at the end if we want to continue to fuel the innovation pipeline. So what we did was we took a step back and we looked into the history of medicine, and we understood that there are some examples that we should look at, and one of them is thalidomide, an anti-vomiting drug, an antiemetic drug that was given to women in the 1950s. This ended up being a global health tragedy because there was no regulation at the time, and more than 10,000 babies were born with birth defects, many more died. And this woke up the world to understand we need to regulate medicines before putting them into the market. And that created what we now know as the regulation of medicines. Most countries around the world already have some form of regulation, which includes clinical trials, assessment, which includes authorization to access to markets, which includes health technology assessment towards defining pricing and reimbursement. So we have picked up this logic of authorization to access to market and pricing and reimbursement, which incentivizes the private sector. At the same time, it ensures the safety and security and effectiveness of the tools that reach the citizens, so that we could apply the same logic to artificial intelligence. And so when computers are going to deal with our health, we believe that we can help deal with the computers at Health AI. And so we, as a neutral nonprofit foundation, position ourselves as an implementing partner for WHO, who is one of our initial partners as a foundation, and many others, focused on expanding the national and regional capacity to regulate artificial intelligence, to leverage the responsible AI standards at a global level. And just recently, the Global Initiative on AI for Health, which is led by 3 UN agencies, the World Health Organization, the ITU, the International Telecommunications Union, and WIPO, the World Intellectual Property Organization, have the 3 appointed Health AI as the co-chair of the Regulatory Affairs Working Group of the Global Initiative on AI for Health. So how do we aim to do this? This ambitious goal of creating this global framework to address responsible AI in health. Well, it all starts at core output number 1, which is to build the national regulatory mechanisms to validate AI tools. What this means is in each country we partner with, we help build the capacity within the regulatory agency of the country to have a team specialized in AI that is capable of implementing the standards that are defined internationally. WHO has announced the aim to have these international standards approved by the end of 2024. That would be an extraordinary achievement, but we need then countries to make sure that they have the implementing power so that the standards don't end up as a book on a shelf. And so we build the capacity at the country level, and then we shift from capacity building to being certification agency. And so basically certifying the team so that everyone in the world knows that that team is complying with international standards. By doing this, we are ensuring safe, quality, effective tools are reaching the market, but companies finally have a pathway in each country on what are the requirements to enter the market and towards getting their technology reimbursed when the technology is used by the health system. By connecting these different teams around the world, these regulatory mechanisms, this will allow us to build a regulatory network at a global scale. Having a network will allow many things. I'll just share one to highlight the importance of this work, which is having our capacity to have an early warning system. As I mentioned before, fear is an important factor that is mentioned many times by citizens. But governments today, if something goes wrong with an AI-driven or AI-generated technology anywhere in the world, we have no mechanism to know. We either find out on CNN or some other news outlet, or we find out in a peer-reviewed journal that it was published 2 years after the problem actually happened. What we want to do is having mechanisms in place that actually have post-market surveillance happening in real time. If something goes wrong, if there's an unintended effect, we can have an early warning system that raises a red flag to, to everyone, to every agency around the world. So if there's a problem with an AI tool in Kuala Lumpur or Rio de Janeiro, or in my hometown of Lisbon, well then everyone, including here in India, will know so that you can assess and act upon it. Moreover, having a harmonized regulatory approach will allow us to address the volume issue. This year, the US FDA was saying that they were struggling to approve 300 tools because they have limited capacity. If we think about the future, where we're going to have to validate thousands of tools, no country will be able to do that alone. And so the idea of having a single country approach to validation of AI tools is absolutely impossible. Having a harmonized regulatory landscape will allow accelerated cross-country validation processes. And by doing this, as each country approves these technologies, they will be fed into one global public repository. So one big database where as a technology, so thinking of India, if you approve a technology in your regulatory body, automatically that technology showcases to the world. For local companies, it's a marketplace for global markets. For governments or health systems that want to invest, having a global repository allows us to have a more systematic and scientific approach to tendering these technologies. Instead of just buying technologies to whoever knocks at our door, we can actually see the different technologies that address the needs that we need to address and choose the one that fits best for purpose. And this will help us provide advisory support to multilateral organizations, to startups, to anyone really who wants to apply responsible AI. So to end, just to say that we will be increasing through our approach access to safe, high quality, effective and equitable AI solutions. And equitable is extremely important as we build this capacity in low and middle income countries. Building trust, which leads to investment, research and innovation. And another important point, having been a policymaker for governments, is that all of this leads to a new source of revenue for governments. So a new source of money coming into the coffers of the state without going through taxation of citizens, because companies pay for the validation process to get access to the markets. So it's a sustainable solution moving forward, and we're looking for potential collaboration for the different components that will allow us to move forward towards creating such a regulatory network. Thank you very much for your attention.
Thank you for the concise presentation that reiterates the need for effective governance for the use of AI in healthcare. So I would now like to invite Dr. Vinod K. Paul to deliver his keynote address, building on all the themes that have been discussed in the panel and building on the ideas that have been discussed so far.
Good morning. Thank you. Thank you very much. Esteemed panel, esteemed colleagues, friends, this is an exciting time, early morning, to discuss something which we believe is transformative, which has caught the imagination of everybody, citizens in general, leadership, politicians, researchers, and of course healthcare professionals. Clearly, artificial intelligence is poised to change healthcare in a very significant way, perhaps in a disruptive way, or most likely in a disruptive way. AI is going to be all pervasive. We had a peek into what it might lead us to from the eminent panelists and from the keynote speech of Ricardo. I like us to remind each other that AI is built above all and essentially on the digital systems. Data, digitalized capabilities, the digital capabilities, digital public health goods. And therefore, the first message for all of us coming from policy enabler from the government is that for us to make the best use of AI and to be in the leadership pole position, our efforts to widen, expand, to have strong digital system in the country is therefore essential. That's where it starts. And we have a lot that we can push for. We have a lot to be proud of. We are in the lead in many ways. The world looks upon us for digital solutions, the classical ones, and on that we have an opportunity to excel in the space of AI and space of AI for health. I have said in one of the earlier meetings, and I'm going to repeat that it is India's destiny to be the leader in digital health, because the building blocks are already there, the capital is here, the R&D system is there, we have the presence of the biggies in the game, and we have taken very important steps over a period of time in that direction, including the Ayushman Bharat digital mission and including Ayushman Bharat PMJ mission, in which Kiran was associated with, but also we have applications such as Nikshay, such as Anmol, such as Poshan Tracker, and above all, the most famous being COVID. So we have the capital available to us to build on. It's our destiny to lead the world in digital health. And therefore, I believe it is our destiny to lead the world in AI for health. That's our destiny. And we, as government and as various sectors and stakeholders, must take the right steps that we make use of our advantage that we have in this regard. And I'm glad that you all are here, and this conference is providing an opportunity for exciting thoughts at a very important juncture when AI is really all over in terms of its buzz. We will devise AI technologies and demonstrate their use not only for India but also for a lot of other parts of the world, particularly the global south. That's our commitment. That's the paradigm on which we will build our discourse, on which we are developing our strategies, Some of that will be unveiled during this conference. There is an inflection point the way we are working from now onwards, I can assure you, within the government. We're progressing like this, but we are now looking forward to progressing through an exponential track. So clear commitment for us to deliver on this. We have to leapfrog. We cannot miss this. We are aiming toward a Viksit Bharat by 2047, and that's about leadership in these technologies, because here we are an early starter, unlike some of the previous ones where we had a lag period. Universal coverage means access to essential, access to important services without financial hardship. So it's about affordability, and it's about the services that we aspire for all of us. And universal health coverage embraces the principle of leaving no one behind. And that's the principle also embraced in the SDGs. So clearly, if we improve access of health through any means, through direct health care, through medicines, through diagnostics, through better systems in a hospital or transportation of patients and so on, we are pushing the goal, we are pushing ourselves toward the goal of universal health coverage. And clearly, digital health layered by AI has a tremendous scope in accelerating our effort in that direction and deepening its reach, because it's about coverage, it's about coverage with quality, it's about coverage with efficiency in fast timelines, and also it's about ensuring the coverage which does not ignore the marginalized, the equity dimension. So all the 4 dimensions can be and should be harnessed through AI and at the backbone of the digital health framework. I'd like to mention that though the discussion featured a lot around decision trees, clinical decision making, and Geeta's work on diagnostic, and I want to return to that in a minute. But I think there are other dimensions of health and AI which must be spoken. First, surveillance. Surveillance for diseases, illnesses, pathogens is very critical. Surveillance for how the health systems are functioning is very important. But let's say put on the surveillance in terms of disease prediction. The pandemic has taught us that our capabilities for surveillance have to be very, very strong and world class. And AI can clearly play a very, very important role, extremely important role. I wish we had AI helping us in early stages of COVID. Maybe some of our decisions could have been quickened. Why not? Just looking back in the rear view mirror. So such tools need to be there, using the One Health paradigm in particular, under the One Health mission of India. Clearly, it will be our duty and imperative on our part that the AI tools are embedded there, and please help us in that regard, because that's a ship which is still to be built, and please educate us as we unfold that, how from the very beginning strong AI presence is made there. One part of surveillance is then an early targeted reach where the problem is, and how do we do it, and I'm sure AI can buy us time. Health system strengthening has been referred to at a very simplistic level. AI can help us on ensuring supply chains. One of the weaknesses in our system, in large hospital, particularly public health system, and in the primary healthcare system, is ensuring seamless logistics, drugs, diagnostics. Hemoglobinometer आ गया, लेकिन strip खत्म हो जाती है. Not that it cannot be done by other, analog means, shall we say, or the classical management or classical business management. Just that a tool like AI can make it happen more readily. And we have seen the power of digital systems in regard to the supplies and so on. It's saying the obvious, but when AI comes into picture, perhaps it will be even more efficient. The QA systems working together and also helping the primary healthcare workers in decision making. which I'll come back again. But here, there is a distinct role because our primary healthcare teams have a certain finite understanding about the issues that they are addressing, and the complexities have to be identified, and a timely referral up the system has to be made. So AI has a role to play using, a systematic approach. A very big scope for AI in health shall be, and we should be very conscious, and some of you should help those processes, are the research and development. We talk about drug discovery, we talk about medtech related, but I want to remind you that there is a lot of learning and research happens in the space of clinical research, patient learning with experience, describing diseases, describing the prognosis. That's a clear scope where research would be useful, and also the upstream basic science and translational research in the laboratories also has a scope, and that must be spoken because AI making a change there will help the entire pipeline of care, pipeline of solutions so it must be stated in this room that AI has a huge scope in research and development for health and healthcare and health products. AI will also transform health professional education, but also the way the doctor will practice. So please help us to do a better job as doctors, and there are things happening in that regard globally. I'm sure we will pick on them very soon. Improved service delivery by way of the algorithms, by way of diagnostics and screening and program evaluation is another space that we are referring to. But this just to say that there is somewhat more larger dimension of AI in health than what perhaps we have been able to cover in this short period of time. Having said that, I like to remind us all, first important message from my side is that we need large data sets. I was in a meeting with the CEO of ChatGPT when he was here, ChatGPT when he was here, and asked this question. I said, what is the big thing India should do to be in step for leadership in AI? And he said, data sets. Data sets, data sets, and data sets. So I am echoing that by telling you that our data sets are fragmented. I'll come to the quality in a minute, but they are all over. In Ayushman Bharat, PMJ, and ABDM, we learned that it's best to have federated data systems which can be brought together. But a lot more must be done. I therefore request us all to think about how to bring together existing data sets together so that AI learns from them, develops out of them, and we don't have to reinvent wherever possible, and we can do it with speed. So I'm making a strong recommendation, which I did to other systems as well, is to bring the data together, and you may be aware that we are talking about India Data Set Platform in a very big way as a part of our new journey for AI. So large data sets, what are the rules of bringing it together? How do we ensure that we use the data and we give credit to people whom data belongs? What are the issues of consent and so on? All that has to be walked through. But the short point is, large data sets have to be brought together, and government itself holds so much of data, but it's all out there, not available. So we need to work in that direction. If we can get to understand the frameworks to bring it all together, Karthik, think about how it can be done. It's an opportunity, and you are in that role now to do it. And we'll do it for the world. Our solutions, I'm again repeating, are not only for India, they are for the world. This is a clear mandate from the Honorable Prime Minister. Our public goods, our health public goods, our vaccination, he always reminded us, is for the humanity. So can we work in a very big way for data sets? And here, a very specific appeal. I think we are weak, particularly in electronic health records. Because decision making, we are saying, but the decision making happens on a particular approach to medicine decision making. Till we change that paradigm, we would be aligning in some ways to use AI to help us taking that process forward and perhaps disrupt it later on. Our EHR journey is lagging behind. Time has come that we move very quickly into it. And there my concern is, what about the quality of that record? I don't know how that can be circumvented. If I don't take proper history, I don't record that history. So it's not there. Then what am I, training my AI algorithm for? Inaccurate information? Incomplete? Where will it lead? I have no answer to this. But this is something that is worrying. Our movement for electronic health records in a systematic way has to really start, and I clearly think this to be the second most important priority. And in this regard, what are the rules of writing an EHR? The record is written by a doctor, and we are 14 lakh of us, 1.4 million, and we want them to become 3.0 million by 2030. How do we have that level of responsible record documentation on the part of each one of us? I hope someday AI can look after this, but till such time, my understanding is that it builds on what we know. So that's my second point. My third point is in regard to the point that, Geeta, you have been making it very succinctly. Please hear her voice. We hear at times that there are solutions, please use them. We ask them, how did you validate? No idea. So first request to all of you, all of us, is co-create the solution. Have the user sitting with you from the beginning. Don't go when you already have invested. So be there. Follow the principles of ethical approach, of doing research. I would like to understand how good your tool is in terms of sensitivity, specificity, negativity. That's the only way some of us can understand this before the policymakers say, go ahead and do it. And answer the point made by Geeta, that algorithm working or the technology working in the hands of the provider, the specific provider, not the person who standardized it. But if it is a health worker, then how does it work in the hands of health worker in terms of accuracy of diagnosis? The same would mean for clinical decision making in the hands of the people, and that rubric is often not handled very well. I appeal to you to look at AI solutions for primary health care, for clinical decision making. I appeal to you to look at one thought of how AI can be used for better child development in the hands of simple families and how we can support them, because good development, good brain development in the first year of life, second year of life will make a huge difference. We believe there's a lot of scope in that regard. So we give you a call to create many, many more AI solutions. Toward the end, let me say a few specific one-liners. One, we will work together to streamline the regulatory system, because the classical regulatory system for health products may not work. We would like that to be one of our jobs to be carried out. I remind you that we have a health technology assessment system in the in the Department of Health Research. Please make use of it. This will come in the path before it is let out into the community. We have that system, but the broad regulatory system would need refinement, and we want to work with you. I give a call to the private sector to please come together, not just by way of product, but also to test the products and share your data to be able to do better. There is that little separation with the private healthcare system that we would like to bridge. My third point is ABDM should gather pace, particularly in the space of ECR and the other elements. Telemedicine is great, but telemedicine has one issue, that it does not give you continuity of care, because next time the phone will be picked up by somebody else. Can we use AI to give continuity of care even though we progress with the telemedicine, which is great? And in the end, let me say that working toward India's leadership for AI in health and AI in general for national development, we would like to make sure that the health AI has the trust quotient which is very, very high. And that point has been made very effectively by Ricardo and others. How do we move on that? Help us wade through that journey. We have talked about responsible AI. The first document on responsible AI came from my organization, Niti Aayog, a couple of years ago. But we have now staring at us So we are now staring at a situation to have the right methodology, tools, and framework to make that happen, and we will very much like us to join in that journey. These words, my gratitude for the opportunity. I wish you the very best. Please continue to help us to create enabling frameworks, enabling policies as we move to leapfrog and to be in the leadership position into near future. Thank you. Jai Hind.
A lot of thanks, Dr. Paul, for this insightful address. Now, in the interest of time, we would not be having the question and answer session, and I would like to take this opportunity to close this panel. I would like to finally thank all our esteemed panelists for their insightful perspectives and for the audience for engaging with the panelists as well. Thank you so much, and hope you attend the other sessions as well.
So halfway.
Yes, yes.
So like the half in an hour. And
Okay.
Yeah. To stand? Okay, do you want to do that now? Now?
Yes.
Okay, I think they're going to do a photo. Would you mind standing kind of in the middle?